COVID-19 has had tragic consequences for people around the world, but the challenges we're facing in healthcare today aren't new. The coronavirus pandemic has simply thrown them into stark relief and highlighted existing shortcomings. Is there a clear path to a better, more sustainable health system in Europe?
The difficult truth is that the pandemic could set back health outcomes for years to come. If we're to make health systems truly sustainable for the future, though, I believe we must accelerate, not postpone, making healthcare more digital, more connected, and more personalized.
We need to do more to discuss how can we implement it.
Right now across Europe, we can make the changes that could not only create healthier populations, but also drive fairer access. Now is exactly the right time to be ambitious about the future of healthcare of Europe.
It seems clear that there is much to be done, and the time to act is now. But for effective action, there must be a plan. And that's where the Future-Proofing Health Index comes into play.
This index is going to be a useful tool to help shed some light on our understanding as to where we are in the EU.
It's always good to be able to compare with others. It allows us to identify best practices elsewhere that can accelerate progress towards personalized healthcare.
And I like the fact that it's multidimensional. They are excellent tools to start a conversation where it needs to happen and help raise awareness among the important groups.
The data from the index is an invaluable snapshot of the current state of play and identifies where improvements can be made. But in many places, the journey into data has only just begun.
Countries are at very different starting points in terms of where they are in the digital transformation. Countries will go at different speeds. We're working very closely with the member states, improving the picture of health data and its use in Europe.
We have been collecting for decades data from our population to be able to serve them better.
The COVID pandemic has given us very concrete examples of just how useful developing the data picture will be, whether it's for personalised medicines, but not just for personalised medicines, for wider usage as well.
Having the data available is one thing, but ensuring the interoperability of that data is another. It's just one part of the collaboration that will be needed to build EU health systems.
It's very important that we have this kind of collaboration together. We could then share and use very sensitive data. And we can also then together learn from each other.
It's important we work together with member states to make sure that the citizen feels at the centre of this digital transformation of health and care that we're developing.
The stakes are high and the future of healthcare in Europe hangs in the balance. But both the Future-Proofing Initiative and Roche believe that the raw materials needed to meet these challenges are already in place. Now is the time for joint collaborative action.
This is a pivotal time for healthcare across the world, but only in Europe is a unique opportunity to rebuild the policy framework for health across a whole continent.
We are at a very key moment in the digital transformation of health and care. And we've seen how the policy and the investment and frameworks for digital health is really strengthening in recent years across the EU, and we're going to continue to see that.
We invite this whole community to continue to remain connected and to work together so that future generations might say that 2020 was the year when the next revolution in healthcare in Europe started.